for some time. Okay, the topic today is ICU pearls. Kitne time
15 minutes. You will have a timer there, and there will 2 minutes जब रह जाएंगे तो आपको bell मिलेगी.
Oh, कोई no issue, tension नहीं. Okay, so pearls of wisdom. So as they say, knowledge you can get from books, but wisdom you can only get from, I don't know, Dr. Aftab maybe, huh? So what is rule number one? What we have learned so far is that don't forget the ICU medicine. ICU medicine is nothing but doing very ordinary things extraordinary right. And that is very important. Because once you enter the ICU, there's a tons and tons and tons of data. I mean, just imagine you are looking at the vent settings, then you're looking at the ABGs, you're looking at the electrolytes and the antibiotics and cultures. So all you have to do is make sure that you have to organize yourself. Make a checklist, have a system, anything, and then you have to go through this thing again and again in the morning round and in the evening round, and you will be amazed at during the evening rounds how many things that you have missed, because it's like variables is like 50, 60 when you're seeing the patient. And then it is good to be smart. I mean, it's good to know the studies, it's good to know the definitions, but the thing is that you have to pay attention to the minute details. So you have to have a checklist and make sure that you don't miss anything. Then Allah has made you the captain of the ship, all the youngsters who are sitting here. But remember, as a captain of the ship or director of ICU, your role is right here. I mean, 14% maybe, if roughly wrong. Because this ICU is nothing but a teamwork. And you have to remember this, that if you're not working as a team, as ICU will not work. I mean, if you enter the ICU, look at the nurses, you have to have a pharmacy backup because they are the ones who are doing the drugs. Even the housekeeping and the administration, everything. Administration is extremely important. All the equipments, all the light source, all the ventilators, I mean, they're all run by the administration. Then obviously you have a backup, a very important backup of RTs which run the ventilators. And then you have NC supports of physiotherapy, speech and nutrition, whatever you want to. But the thing is, you are the only captain of the ship, but the main thing is run by the team. So don't forget that when you enter the ICU, there are many other important people who are doing the work. Then one of the most important things, and very underestimated in Pakistan, unfortunately, and underpaid, is the nurses. I mean, nurses in ICU are the main pillars of the ICU. I mean, is unimaginable. I mean, they take care of the patient, they do the washing, they wash the diapers, they change the diapers, the medications, everything. And then, obviously, they're not highly paid as the nurses are paid in West. So they have a lot of experience, especially the experienced nurses. So do listen to them, because they are the ones who are sitting with them 24/7 or 12-hour shift. And sometimes you are wrong and sometimes they are right, but the thing is you have to respect what they are saying, because something they are right. And for the youngsters, make sure that you have a good liaison with the nurses. You will make the nurses unhappy and they will make your life miserable at night. So for the youngsters, just be very, very nice to nurses. Then obviously a small thing, ordinary thing, but it is very cumbersome. If you're seeing, let's say 14 patients during a morning round, and after every 14 patients, you have to wash your hands thoroughly. But the washing hands are so important that it decreases the infection rate, and that's the only hands down technique that have shown that have decreased the incidence of infection in the ICU. And obviously when you're rounding, you make sure that you go through the VAB bundles, DVT and GI stress, and obviously make sure somebody having bad sores and no bad sores, and you have to look at all the hardwares that the patient is having. So it's just a matter of making a system. Then there's a knee-jerk reflex for us and for the youngsters, especially if they are called in the middle of the night that somebody have altered mental status, and they will say increase the propofol or give dormicum. But it is better to make sure you remember these 5H, in which the hypoxia, hypercarbia, which is the saturations, and obviously the ABG. check the glucose checks, make sure the blood pressure is okay, MAP is okay, and above all, go through the medications, maybe some new medications that you have started, which normally is overlooked. So medication side effect is very important if somebody is getting agitated in the middle of the night. So don't sedate the patient, just try to look at the patient first. Then, yes, when the patient is intubated, once you come to the round, the first thing you want to ask is the why patient is intubated. If you don't know why the patient was intubated, I mean, there's no reason, or there's only, I mean, how will you know that when to extubate the patient? So the reason the patient is intubated is extremely important, whether that was the airways, that was the hypercarbia, that was the mental status. And then the self-extubation is a disaster. So, I mean, self-extubation can be saved if you are having a proper rounds. Make sure that you have a plan for extubation. Nurses knows when to lighten the sedation. And then make sure the family is not touching the patients. The thing is, I mean, this is the one thing that you can doable thing, and sometimes if it happens, everything goes down the drain. So always respect the airways. That's the big thing. Again, if the patient is vented and started alarming or get agitated on the vent, don't go and just turn on the alarm button off. Make sure the patient have breath sounds, make sure the tube is okay. Look at the peak airway pressure. Sometimes they can just have a pneumothorax, spontaneous pneumothorax, and depending upon what mode you are on, you have to make sure the peak pressures, and look at the SATs, obviously. So the thing is, don't sedate the patient when they're agitated, either on the vent or if they're not in the vent. Make sure that you go through your checklist and make sure that you are doing everything right. Small things. All right, this is a little busy slide, but very important. Whenever you go for the round, obviously everybody does it, but you have to go through the antibiotics and cultures daily. And it looks and it sounds very simple, but it is not. Again, if you're rounding for 14 patients, going through the medications every day, going through the cultures every day, because the next patient will have the same thing, so you kind of lose the track. But make sure that you go through the antibiotics and try to cut down on antibiotics as soon as possible. And the same goes with the medications, that you have to go through the medications, and sometimes you will be amazed at how things can be missed. And you can stop and try to cut down on the medication. And whenever there's a worsening of patient condition, just go through the medication list again, because maybe there's an antibiotic or something else that is making it worse. So just making a system, don't miss it, and go through this again and again. Finally, I mean, this is normally what we do, the medical students, and this is very true for the ICU, that you don't read the chest X-rays and you don't read the monitor. I mean, on the chest X-ray, sometimes the X-ray will get worse, but you know the X-ray worsening is not always pneumonia. Sometimes they have fluid overload, sometimes you have atelectasis, and the patient is okay, then you just don't try to go up on the antibiotics or try to go up on the ventilator settings. The same goes with the monitors. Sometimes the patient have an EF of 40%, 35%, then you don't have to shoot for the MAP of 65. And sometimes the monitors can behave weirdly, and then you can see the ST waves and ST. But the thing is, if the patient is doing okay, then you just don't treat the monitors. I mean, try to see what the patients, try to touch the patients, which is a common problem in ICU now, because normally there's a lot of labs and a lot of CT scans and monitors. So always checking the patient is always better. So this is, I mean, our society is obsessed with food. So we are. And normally two things. I mean, if mother is lying on the bed, the daughter will have one concern, that my mother is not taking properly. And she will be less concerned about the blood pressure or the meningitis or whatever she's getting. But she's concerned, and sometimes they are right. I mean, sometimes you will do the round and you will ask the nurse if the patient is taking orally, and they will say yes. But the daughter who is sitting next says that no, she's taking orally, but she's taking only few sips. And then obviously daily calories are important. Now there's a lot of data, we know that, about the permissive underfeeding of ICU patients. And this is a recent analysis came out in 2024. And it basically showed that if you have a hypocaloric diet, it can decrease not the overall mortality, but the ICU mortality and the ventilator days. But don't forget to ask about the calories and the patient feeding. Then finally, the most important part of the ICU. ICU have two parts. One is once you are dealing with the patient, and the second equally important part when you are dealing with the family. If you fail in dealing with the families, I mean, literally you have failed everything. Because, I mean, this is kind of routine for us that somebody is lying on the ventilator, but you can imagine 10, 20, 15 members who have their loved one on the ventilators and they have no clue whatsoever. So you have to talk to them. It's a matter of debate. I mean, what I will urge that you guys should be engaging them in the rounds. In the West, it is a common practice now, but in Pakistan, they still want to do the round alone, and the family is sitting outside with the door closed, and then the consultant will go out and then talk to the family. There's some type of jail is going on. But there are studies which shows that if you engage the families in the round, it is helpful. And then there was a conference like 6 years ago in USA, ATS, and there was the whole session going on, and the title of the session was "Let Them In." And there was a lot of people there, and they have a lot of questions. They are saying that if we round with the patients and the PGs will goof up and the family will know, and the things for the medico-legal thing. And they said that they have done these surveys and they have the proof that most of the time families are much more satisfied if they are engaged in the round, if they are sitting next to when you are rounding and when you are talking to the family member. So they can be a part of the team, part of the decision. And obviously it will help to cut down the time on the counseling, because they have listened to everyone and they have the plan, and all you have to do is just walk away and they'll be very, very happy. So family counseling is so important that in ICU exam in FCPS, in 12 talks, we have 2 talks for family counseling. That's how important the family counseling is. And remember, ordinary things, very ordinary things, all I have told, it is just the routine things. It is just the routine things we just miss it in the daily busy schedules. I'm done. Any quick questions, please?
We can also have the question and answers later if they wish.
Okay, thank you.
Thank you, sir.